you have to use these things in a sequence. It was the synergy of each product working together. And I saw that with my skin, and that was how I developed the system. And my mother started using it, and we started perfecting it. I figured out different things along the way, like the better toothbrushes to use, and the fact that your sinus health is included in this whole biofilm of your mouth and your nose. I found out how to acquire xylitol and add that into the program. And all of this works together. That's the incredible thing. And when you use this whole program as a unit, well, my mother lived to be 95. She lived 50 more years with minimal dental treatment. I think she had a couple of cleanings along the way. I think she had a couple of fillings that fell out here and there that she had replaced. But I mean, her teeth, from having to have full dentures at 45 to living to 95 with the same number of teeth as she had at 45. Tell me about that one with minimal treatment.
Hello, Dr. Phillips. You have developed the complete mouthcare system and authored 2 books on oral health. So welcome to Modern Healthspan, and thank you so much for joining us today.
Absolute pleasure. Glad to be here. It's my little topic I love talking about. So
excellent. So Dr. Phillips, so you have developed this mouthcare system, which does not include flossing, or indeed the need for quarterly cleaning at the dentist, and many other things that dentists suggests. So I'd like to introduce the system, but maybe if we could start with, what is the strategy? What's the thinking behind how you put together the system?
Certainly. Well, I'd love to tell the story, and I'm going to tell it as quickly as I can, because this all began. I decided I wanted to be a dentist in England at a time when women were not dentists. They didn't want us because the dental medical schools and dental schools had rugby football teams, and women were not very helpful on that rugby football team. I think that was the main reason. I don't think they thought we were not capable or not strong enough, but that might have been a reason too. They certainly, in the 1960s, asked women to have physics, chemistry, biology, and Latin at a very high level. The A levels, if you're in England, in America, it's kind of, this is to get into university. I'm not sure exactly how it would be equated, but I went to a boarding school and studied physics, chemistry, biology, and Latin from the age of 13 exclusively, giving up all the other subjects, so that by the time I was ready to apply to medical school, I had the top grades in A levels, first time in those subjects. So I ate, slept, dreamed about physics, chemistry, and biology, basically, right up until I went to medical school. And then I didn't know much about dentistry. I'm not exactly sure why I chose it, except my brother hated going to the dentist. And I thought it was about helping people have healthy teeth. And I was totally shocked when I entered dental school to find that it was more about just filling and extractions, and it was depressing to me that was what dentistry was. Now, I'm going to layer on that the fact that my father had all his teeth taken out at the age of 35, entering the military in England. He had gum disease, and they just took all his teeth out. He had full dentures, which is pretty normal back in those days. That's how they dealt with problems, was take out the teeth. And then, and that was with baby teeth as much as with adult teeth, which is, I think, why so many problems have occurred. But my mother then, 10 years later, she was 45, she was told to have all her teeth taken out. And that was the point at which I was at dental school as a student. And it just so happened in those days, a lot of research was done by scientists that were involved in the dental department. It wasn't like today where there's the sort of researchers out of the clinical and research was wound together back in the day, which is how I think it should be. Anyway, these scientists had just done started a study in a convent with nuns, and they were discovering that the earlier these nuns had all their teeth extracted, the more likely they were to end up with early onset dementia. And this was really important to me because in my family, early onset dementia was the thing. I looked around at my family and all the aunts and women. It's women. It seems to affect women differently from men. We still today don't know why that would be, but they happened to do the study in a convent, so it was women, and it's the loss of all your teeth. The younger it occurs, the more risk you are at for developing dementia. And that, I think, is still today, it's not broadcast because we don't want to terrify everybody, but I think it's a reason why we need to look at this question of, should you extract a tooth? Should you do a root canal treatment filling? And I can explain, if you want to, why I would recommend keeping a tooth if at all possible. Whereas today the implant industry says, take them out, we can do implants, take them out, full dentures. I would be very hesitant, and I was for my mother. I told her, don't have all your teeth taken out. It appeared to be that 12 teeth is the number you have to hang on to if you possibly can. That is just 6 on the top and 6 on the bottom, but still, it's an important number that they seem to have come to. I think a full complement is what you're looking for. I even don't recommend taking out wisdom teeth unless you absolutely have to. For that reason, there's lots of value in teeth. Anyway, my mother did listen to me. The next thing I had to do was figure out, how do we keep her teeth? And I was, in those days in England, there were no hygienists, there was no periodontists. It was dental students like me cleaning your teeth and cutting your gums. They did something called the gingivectomy, which cut the gums, and it was awful. And I knew I didn't want to put my mother through that. And I knew it didn't work. So I told her, let me try to figure this out. And now I have to do another backstory. At this boarding school where I was learning all the science before I became a dentist, I had terrible acne. My skin was a mess. And back then they said, oh, your skin's dirty. We got to scrub your skin. And they gave us like horsehair brushes and ivory soap. And we was lined up the people with acne at this sink. And they'd actually pull the brushes out of a bag. I mean, I think about it now and the transfer of bacteria, and I'm like, oh gosh. And we would scrub our faces. And I hated my skin. I hated having acne. So I scrubbed extra hard. I did everything. I did extra scrubbing. Nothing. That was it. Then we put water on our faces, and it was hard water because we were in the Cotswolds in England, and a lot of lime in the, it wasn't the right thing to be doing to our skin. We now know that, again, another interesting factoid is that the skin biome is incredibly similar to the mouth biome. The bacteria in the skin, on the skin, and how they behave is extremely comparable to the skin and the mouth are much more alike than the mouth and the gut. So just a factoid, again, to put into context. So I had struggled for years with my horrible skin, hating myself, feeling depressed, feeling embarrassed. I was doing everything I could and nothing was working. Why wasn't it working? Because it was the wrong advice. What happened one day, I was walking through Selfridges in London. A lady from the Clinique counter that just started this Clinique makeup asked if she could examine my skin. I was really embarrassed, but she had this kind of beginning of a computer. It was actually just like little things she put across a board, and then she from that was able to say, you need this very delicate cleanser, toner, moisturizer. And these 3 lotions go on your skin one after the other. And you don't want to use soap. You don't want to be vigorously doing any of that, because you're irritating your skin without the moisturizer, without the right chemistry. And I was all about chemistry. So off I went, pH balancing, doing these 3. It took a week. It was a week. And my skin was like beautiful. Everything cleared up. And, that was so shocking after years of feeling so helpless, so irritated, so in so much pain and suffering, that when I heard dentists telling people to brush and floss, if it's the wrong advice and it's not working, we have to find a better way. And here was my mother. She brushed her teeth. She was a clean, healthy individual. I remember her foaming up all this toothpaste, and it wasn't that she didn't care about her teeth or she was lazy or she was dirty or anything. And this so resonated with me that what she was doing wasn't adequate. I had to find a deep cleanser. I had to find a toner. I had to find a moisturizer for her mouth. And the first actual product in my complete mouth care system is something called Closis in America. It's Ultradex in Canada and the UK. And at the time when I started this, it's like a deep cleanser. We were using it as dentists before patients' treatment appointments to try and get rid of the bacteria that might spray into the air. Now, this we're talking about a long, long time ago. This has now become a thing in America, finally, where people go for a dental appointment and they will rinse their mouth before they start with some kind of mouthwash. If I were you, I would take Closest with me because this doesn't damage the bacteria of your mouth. What it does is it interacts with the saliva in your mouth to form oxygen. And it is the oxygen that cleans your mouth. It oxygenates, depresses the anaerobic bacteria. It helps the good ones. It's a wonderful, deep cleanser. And that was what is the first stage of my complete mouth care system. The toothpaste was the toothpaste they had just in the 60s actually done randomized clinical trials, something that's never been done with any other toothpaste, to show that it actually could reverse a cavity. It could heal a cavity before it started. It's the old $1.96 Crest. It's made with silica. Silica helps your teeth to mineralize themselves. It's made with some very specific fluoride. I am very specific about the fluoride that I recommend and the dilution of it, and that it has no glycerin. And this is why this toothpaste was the brushing part of my complete mouth care system. The Listerine is, again, much maligned. Most of the products I recommend are much maligned. People think that this is a terrible product. It's actually essential oils. Most people are shocked to find out that the active ingredient is not alcohol. It's nothing like strong enough to do anything in the mouth. It's also not able to sterilize your mouth. If you use an alcohol wipe on your hands, you have to wipe it until your hands are dry. And it tells you not to use if your hands are dirty or slimy. Well, your mouth is dirty and slimy, let me tell you that. So this is the reason this works is because it contains thymol and menthol. And thymol and menthol are two essential oils when you use them in this incredibly dilute. That's the reason for the alcohol, is how it gets the essential oils into solution. Yes, I wish it wasn't blue, and I wish a lot of things about it, but it's amazing because it's like a toner. It really does clean up the surfaces of the teeth so that they can repair, remineralize. And the other thing in Listerine is there's eucalyptus, and eucalyptus is actually really healing to regrow your gums around your teeth, tighten them up. And the final part of the system is kind of like the moisturizer, back to that skin analogy. And this is the ACT. The ACT is a dilute 0.05 sodium fluoride, no glycerin, mouthwash. The new bottle is a little bit different, but there's no alcohol in this. So this is your moisturizer. You see, you got to understand that each product separately would behave very differently. When you put something into a system, I mean, anyone who knows about skin would never just dab astringent toner on their skin and just say there, especially if you live in a dry climate. Your skin would dry up like a prune. you have to use these things in a sequence. It was the synergy of each product working together. And I saw that with my skin, and that was how I developed the system. And my mother started using it, and we started perfecting it. I figured out different things along the way, like the better toothbrushes to use, and the fact that your sinus health is included in this whole biofilm of your mouth and your nose. I found out how to acquire xylitol and add that into the program. And all of this works together. That's the incredible thing. And when you use this whole program as a unit, well, my mother lived to be 95. She lived 50 more years with minimal dental treatment. I think she had a couple of cleanings along the way. I think she had a couple of fillings that fell out here and there that she had replaced. But I mean, her teeth, from having to have full dentures at 45 to living to 95 with the same number of teeth as she had at 45. Tell me about that one with minimal treatment. So, I started then suggesting this to my patients in my dental practice as I went along. I added to it because I worked in Switzerland and learned a lot about nutrition, timing of eating and drinking. These are all the things that I teach people about. Gum massage to get your gums to actually regrow. And the use of xylitol, I've perfected that along the way, so that you have a kind of foolproof system. Now, you may not like one or other of these products. Listerine, isn't it? If you don't want to do it, you don't want to do it. But I'll tell you, nobody talks about the toxicity of fillings. I know they talk about silver toxicity, but what about the plastics in your mouth? What about blocking up the grooves where healthy bacteria is supposed to live with fillings in the first place? What about dental cleanings? They're stripping off the biofilm of your teeth. Do we want to do that? I don't think anyone's really looked at that scientifically. Do you take an antibiotic every 6 months to kill off all the bacteria in your gut to try and stay healthy? No, we know that's not the way. You every day try to nurture the good bacteria in your mouth so that you don't need an antibiotic. You're so resilient. It takes care of you. And that's my philosophy with your mouth. And you mentioned that I don't talk about flossing. I've never needed to. I didn't until I came to America, and everybody's floss, floss, floss. And I'm like, really? What I had seen was that women in particular, who are so much more compliant than men generally, I think, when they're told to do this stuff, they floss like crazy. And they have more gum recession and more sensitivity and more damage to their gums because they're given the wrong advice. It's kind of like me scrubbing my face. That wasn't the way. I created grooves and cuts and bleeding and treat it so that you get a healthy biofilm. There's no infection. And you won't have plaque. You won't have any plaque. There won't be any stuff stuck between your teeth if your gums are there. Now, if you're coming at this in a very late stage where you've got huge gaps because your gums have disappeared, you may have to floss to get some of that. Or if you've got a lot of fillings, because the fillings themselves create these places where food gets stuck. They got little ledges, or you got a crown that's the wrong shape. Or once you start having dental treatment, you're at much more risk of needing more dental treatment because you're at more risk of food getting stuck and things going wrong. Perfect teeth are worth hanging on to. That's why I teach people to reverse cavities so they don't need a filling. It's so valuable to have perfect teeth and hang on to them for your life. So that's the story. It's long, but it explains how I came about my system and why my system works.
The holiday season, while joyful, can be incredibly demanding. From hectic schedules to increased social obligations, stress can take a toll on our well-being. Magnesium plays a crucial role in managing stress and promoting relaxation. However, many individuals are deficient, leading to symptoms like fatigue, poor sleep, and increased anxiety. Magnesium Breakthrough from BiOptimizers offers a comprehensive solution. The unique blend of magnesium citrate, glycinate, taurate, and more ensures maximum absorption and utilization by our cells. By replenishing your magnesium levels, you can enhance your body's ability to cope with stress, improve sleep quality, and maintain a calm, balanced mood. It's a great gift for yourself or a loved one this holiday season. To experience the benefits of Magnesium Breakthrough and take advantage of an exclusive $10 discount, go to bioptimizers.com/modern and use promo code MODERN10. By subscribing, you'll secure a consistent supply while enjoying discounts and complimentary gifts. Thank you for your support. Okay, so you talked about the microbiome, I guess the biome of the mouth, but yeah, but you're using Listerine, which kills 99%, or so.
Oh, I'm going to stop you right there.
Okay, so talk about the oral microbiome. Yeah.
Yeah, you see, this is horrible marketing, and this was marketing done in the day and age. Now, let's go back. I mean, even most dentists and hygienists will talk about plaque and biofilm interchangeably. I don't know if yours does, but a lot still do. Let's talk about the mouth biofilm and then go back to Listerine. In the mouth, you have bacteria. The whole population of bacteria is called the oral microbiome. It's the complete collection. 20%, the small percentage, float around in your saliva. They are single cell. They are floating like plankton in the ocean waters. They love to attach to your teeth. They love the backwaters, the little places where you don't brush very well. Did you ever do one of those pink tablets as a kid where you chew up the tablet and it's stained where you didn't brush properly? Okay.
Yeah.
I'm thinking of reintroducing that because that's the plaque you don't even know you've got. The places where when you're brushing every day, you brush, you turn your wrist and you miss these 3 teeth every day. We all do it, unless we're being really focused on brushing our teeth. There are difficult places where our teeth are slightly crooked or they stick out more, and the bit behind is where the backwater, that's where the plaque sticks. And the thing is, the stuff that's loose and floating around is easy to kill bacteria in that. And in those floating around bacteria are the ones we have to think about, the ones that form plaque. Now, in 2007, that wasn't that long ago to me. I know exactly what I was doing in 2007. And it actually took until 2014, 15 for the results to come out. So that's even closer to today. So most of the people watching this probably can identify with 2015. That was when we discovered the Human Microbiome Project, which was an international project where they had scientists all over the world looking at the bacteria on and inside the human body. And they looked at every orifice. They looked at the ears, the mouth, the nose, the vagina, everywhere in the body. And they documented the bacteria in thousands and thousands of people that they were looking at. And as far as the mouth went, they were astounded because they found over 800 kinds of bacteria. Now, prior to that, and I think we could probably say it was about 2014, only a few of us were really into this before and during. And they were mainly the people in the xylitol world because we knew something about xylitol. We knew that xylitol modulated. It didn't kill. It just changed things in the mouth to promote more good bacteria and get rid of bad ones. And we knew that from 1970. And we knew that in 1970 because what they did with xylitol was they gave it to pregnant mothers who had 100% plaque. And in those days, remember, they thought plaque and biofilm were the same. So they thought that meant the mouths were just absolutely seething with plaque. And they gave these mothers 7 grams of xylitol, which is like 7 pieces of gum a day, and with 1 gram of xylitol in each piece. So they ate this. It was a blister card, you know, with those where you push out the gum. They gave each woman one of those a day. And for the last 3 months of pregnancy and for a year, these women had 7 grams of xylitol a day. The baby was born after 3 months, and the women continued to eat xylitol for a year. Then the researchers took all the xylitol away. No more xylitol. They left the country. There was no special dentistry. This is a country with a high decay rate. Children have high rates of decay. The researchers went back every year and looked at the children, the teeth of the children born of these mothers, not the mothers. What they had discovered was these children at 6 years old had 85% less tooth decay. And remember, the babies didn't have any xylitol. They were too young when they left the country with the xylitol. So the only change that had occurred was in the mother's mouths. This made us fully aware that the women with 100% plaque in their mouths, they actually measured it, over the 6 months, the first 6 months of them taking xylitol at that dosage, had gone from 100% plaque in their mouths to 92% plaque gone. Gone. But we didn't know what else was in there. They just eliminated the plaque. Now, if you're a pediatric dentist, 6 months, 3 months of that was when the mother was pregnant, 3 months was after the baby was born. Baby teeth come in at about 6 months. So by the time baby teeth were erupting in the child's mouth, the mothers had healthy bacteria in their mouths, completely healthy. I don't know if I'm describing this right. You're nodding, so I'm hoping so. So the mothers were kissing their babies and transferring to baby teeth the bacteria that stick on baby teeth that were healthy. In other words, the microbiome that sticks on teeth were healthy. And what the researchers realized was that was protective. It was not just protecting the baby teeth at the age of 1 or 2, it was being transferred into that child's mouth as the child grew year after year. And this is what we know now. If you take care of baby teeth, and ideally by helping the mother, pregnant mother, have a healthy mouth, and all the family kiss the baby with healthy bacteria, the baby teeth get covered with healthy bacteria. And this, now we know healthy biofilm exists. It doesn't have to be plaque. Plaque is infected biofilm, infected with plaque-producing bacteria. But if you separate those 2 kinds of biofilm and you ensure that your child grows up with healthy biofilm, as I was able to do with my youngest child, she has never had a dental cleaning. She has never had anything much done to, she's never had anything done to her teeth. Her wisdom teeth erupted perfectly fine. Her mouth is healthy. She's 35 years old. Never had a dental cleaning. Actually was in a Whole Foods Smile ad because her teeth are beautiful. She's never whitened them. She's never done anything to them except use the products that I recommend to keep them healthy. So this is possible. This is what they do in other countries. In Denmark, where they use this for pregnant women and children, the average amount of decay in Denmark is 1/4 of a tooth per person, adult and child, countrywide. What would American dentistry do? In Finland, they have understood this for so many years because xylitol is not new. Xylitol is 100 or more years old in these countries where they have the birch tree forests, which is where xylitol comes from. And for people who have not heard of xylitol and are saying, what is this? I'm just going to grab a few things. Xylitol is a granular sugar. It comes from birch trees, but it looks just like a pack of sugar if you buy them in little packets. And you can bake with it, you can cook with it. It's diabetic safe. It tastes exactly like sugar. During World War II, it was used in place of table sugar in Europe and in England. And what they discovered was after the war, people had very healthy teeth. And some scientists did some studies and noticed that children who grew up eating xylitol, in other words, with a healthy oral microbiome, these children didn't get ear infections. And a nasal spray was developed back then with xylitol, which you can buy for children and adults. And it makes the microbiome, the bacteria lining your nasal passages, healthier. And for children, if you do that, you'll help stop ear infections because the bacteria in children get into a little tube, the back of the throat. So the health of the mouth and the health of the nose for a child is really important. And if your child has plaque or unhealthy nasal passages, they'll probably be getting ear infections. So xylitol nasal spray is the safest, healthiest way to adjust that. And so in Finland, they have been handing out xylitol as either a little mint or a piece of gum in preschool. As the kids arrive, they give them a piece of gum, they chew it up, get the xylitol out of it, spit it out, because that's how you use the gum. You don't chew it for an hour or more like they do here in America. You want to just get the xylitol out of the gum, or you take it as a little mint, like a breath mint that is made with 100% xylitol. And it's the xylitol that feeds the good bacteria and that makes any plaque that's stuck on your teeth slippery. So I've diverged into xylitol just to explain that there is a big difference between the bacteria that are floating in your mouth, excuse me, that are 20%, and the 80% which are stuck. They actually weave themselves into protein from your saliva, and they attach to teeth the minute the baby tooth comes into the mouth. Your teeth are always covered in biofilm, kind of like your dog bowl's always covered in biofilm. If you have a dog, you know it's slimy. That's what's over your teeth. It is a kind of slime. If you start getting healthy teeth, I run my tongue over my teeth and they feel slick and clean, and you don't see it. It's translucent. Now back to Listerine, and that's 80% of the bacteria in your mouth are in biofilm. And they are in a community because they lace themselves together. And just like a Roman army with shields, when you start lacing bacteria together to form biofilm, they are not the same as those little individual cells. They become a unified unit with a strength and a capacity that's totally different from the little individual cells. And these little individual cells, yes, they're very prone to the essential oils, especially the ones that cause, and that's the word here on the label that you need to, kills 99.9% of the germs that cause. If that CAUSE word wasn't in there, it doesn't say it kills 99% of germs in the mouth. It's marketing, and marketing has rebounded on Listerine because the cause of bad breath, plaque and gingivitis, is a specific kind of bacteria called Streptococcus mutans. And Strep mutans begins its life as a little round seed with a hard shell. And the essential oils of Listerine pop that shell. And that's how Listerine attacks the 99.9% of bacteria that cause plaque to form. Because the life cycle of these little round seeds is that they find a tooth to land on. That's what all bacteria are looking for. And if that tooth is primed, in other words, if it's porous because you're not using the right products, it's got open spaces, it's like attractive to these teeth. And believe me, my system makes your teeth unattractive to these teeth. It makes them slick and shiny and repel them. But assuming you're using, you could be using something very healthy, like some of these mineral pastes and things actually put the wrong charge on your teeth. So your teeth get really furry feeling, and they attach these little round seeds, which then grows plaque. They change from a little round seed into a little elongated bacteria profile that has little tendrils that actually glue the plaque to your teeth. That it's made from sugars. Now, if these plaque bacteria, they will absorb sugar. That's why sugar causes tooth decay. It actually, the sugar doesn't attack your teeth. Sugar feeds these elongated bacteria that then produce these sticky tendrils that glue them to your teeth, and they multiply. And they glue themselves together, one next to the other, like little rows of soldiers. And then they layer one upon another, and they get so thick. If you've ever scraped off something white off your teeth, it is a seething mass of those bacteria. Just so you know, that's how I would describe it to my patients, particularly little boys who like the graphics. Because if you put that under a microscope, and the thing is, they did that over 300 years ago, the first guy to ever find the lens of a microscope, a guy in Denmark, Lowen, somebody, I forget his name, Lowengrowth, I think his name was. He saw through this lens, because he did it with his teeth, some scraped stuff off his teeth, and saw little animals through the lens. It is a bacterial disease. Plaque is bacteria. So using a length of string or a toothbrush bristle, guess what happens? Every time you brush your teeth, you're picking up all those bacteria on your toothbrush. If you then store your toothbrush in a drawer next to other people's, under a cover, in a bag, in your travel bag, those bacteria are just multiplying. And if you give them low oxygen conditions, they'll become anaerobic. And that's what happens on your tooth. As the plaque thickens, the ones on the inside change. They start to not be able to breathe properly. There's too thick a blanket on top. So they turn and become anaerobic. Once they're anaerobic, they produce toxins, poison. And it is that poison that makes your gums puff up and swell and bleed, if the bleeding is caused by plaque. And that is the beginning of gum disease. So why do I like Listerine? Because not only does Listerine help grow gum tissue, which is one good reason, but the second reason is it actually gets rid of, they cannot get into any of these bacteria once they're stuck on a tooth. Listerine is incapable of that, but it can work on the bacteria that are floating in your saliva. That's the only thing it does. It doesn't penetrate the plaque. So you can't get rid of plaque just with Listerine. In fact, you'll make it worse. That's why we need xylitol. As I told you, the whole big story of the pregnant women, xylitol gradually gets rid of these bacteria. It doesn't kill any of them. It feeds them, and it feeds all the good bacteria in your mouth. And the plaque bacteria, these ones that usually feed on sugar, they absorb the xylitol, and xylitol is a 5-carbon sugar. It's only got 5 molecules, a different shape. I haven't got 6 fingers, but if I had 6 fingers, this is a sugar molecule, and this is a xylitol molecule. And once these bacteria have absorbed this thing, they cannot, it's like the wrong ratchet. It just can't get a hold of the sugar for energy. So they run out of energy, and they can't make these sticky tendrils anymore. And so they become slippery. And the next time you brush your teeth, they're going to slip off your teeth. So you just have to do really vigorous, good toothbrushing, and you will get rid of this plaque. And if you gently floss, I'm not opposed to that. But do you understand that if you're not using xylitol and you're not getting rid of these new bacteria that are just waiting to land again on your new tooth, because that's what happens if you don't get rid of them in your saliva, and if you don't get rid of them off your teeth, they just regrow and regrow and regrow. Every time you clean your teeth with floss and brushing, every time you go to the dentist and have a dental cleaning, perfect, until you go to the front desk and the saliva in your mouth that's full of these bad bacteria land on your teeth and start growing infected biofilm again. This is why I say to people, use my complete mouth care system, use xylitol, because it will gradually, like it did for the pregnant women, over 6 months, you will have from 100%, you may have 100% strep mutans right now. I've had many patients, especially if you have Sjogren's, dry mouth. Over a period of 6 months, you, like those ladies, will have eliminated the plaque from your mouth, hopefully with my whole system. Then you go for cleaning. Maybe you have a little bit of staining where those backwater plaque got stained up. That happens. And if you don't use a decent toothbrush, and I recommend a fairly resilient toothbrush. They're called mouth watchers. I have nothing with this company. They don't pay me a nickel. I have to order mine from Amazon like everybody else. Or they're in natural grocers and Whole Foods. But I like this toothbrush because it's very dense. It's got what's called flossing bristles. So they really do a good massage of your gums. And they just stay good for about a month. I think you should be changing them out. And I think you should be using 2 brushes, one for the morning, one for the night, so that you're not growing anaerobic bacteria on the bristles. If you have a dense toothbrush, and you will pick up bacteria from your mouth when you brush your teeth, the best way to clean a toothbrush is to dry it. So stand it up in a cup, put it in the window if you can, dry somewhere, not in your shower or in a wet bathroom, but somewhere where it can dry. I mean, if you're on a cruise, take it out of those silly little bathrooms and put it in your bedroom, because that's humidity and the wet bristles is where the worst. Do you remember I told you they produce the toxins that start gum disease? People who travel a lot always have more gum disease, probably from their stupid toothbrushes. I mean, it isn't difficult to clean a toothbrush or buy some cheap ones if you're traveling a lot and throw them away. Just throw them away. For a day or two to use a different kind of toothbrush doesn't matter, but it really matters if you're traveling with your $300 electric toothbrush and you're using dirty old bristles. That's far worse for your mouth. So
Right.
these are the things I teach people that are shockingly simple to do that nobody has ever told them. And I mean, when my mother was in assisted living, that is a cesspool for mouth health. I'm telling you, it's a terrible environment because when you talk with people, these bacteria travel in clouds about 6 feet around your mouth. So if you're talking to an elderly lady with horrible mouth health, and my mother's sitting on the couch next to her, how is she going to keep her mouth healthy without my complete mouth care system? I would go in every night to clean my mother's teeth. Now, I know that's not feasible, but I think we need to understand this is a huge problem. It's a huge problem. Assisted living is an enormous problem. And I think we may need to do things differently. I'm not suggesting everyone in assisted living does my system, but I think we need to find a good method to control the spread of infection from patient to patient in assisted living. Yeah.
Speaking of older people, so anyway, thank you. Yeah, so that.
Well, you asked me a question. I should answer it. No,
Yeah,
Listerine doesn't kill
kill.
all the bacteria in your mouth.
Yeah, right.
Even chlorhexidine, and chlorhexidine is the strongest antiseptic that there is. Chlorhexidine is the one that has been shown to, it's a very good surface killer of bacteria. It can take the top layer off some of these biofilms in your mouth, particularly on the back of your tongue, which is where nitric oxide is made. And I think that's the question you may be wanting to ask me. What about nitric oxide in? And do you think people know about nitric oxide? Have you done other talks about nitric oxide?
Yes, we did one on nitric oxide, particularly in how the mouth microbiome is so important for its development.
So important. And just so you know, I have used my complete mouth care system now for 40 plus years, obviously, since I was helping my mother. It's probably 50 some odd years now, longer, completely like this with xylitol and everything. And I test my microbiome, all of it, often. And I have optimal denitrifying bacteria on the back of my tongue. In the book I wrote, Mouth Care Comes Clean, that I wrote after the Human Microbiome Project, I actually talk about these denitrifying bacteria and the importance of them, and the fact that I believe they are central to a healthy microbiome. I always have done. And I am not concerned about my system eliminating them. And I have tried to talk to Nathan Bryant, who is one of the PhD researchers out there, who is not a dentist. I have tried to contact him. He's been in Austin, but we never actually got to meet, unfortunately, because I think that some of these researchers are looking at the planktonic bacteria, these bacteria floating in saliva, and reading them differently from the bacteria that are in the biome that is attached to your teeth, the 80% that is coated over your mouth, that to me is far more vital and important than the stuff that's traveling through, the 20% that travels through, that changes and is much more fluid. In the microbiome attached to your teeth, they have done studies to show 40% of these bacteria developed in childhood. In childhood. Periodontists tell you we can't change the microbiome. There's nothing we can do. We put back antibiotics down the gum. We give you courses of antibiotics, but they just come back. That's the point. You can't knock out this biofilm is so resilient. The only thing you can do is modulate it, persuade it, nudge it, tweak it. It's like a garden that has grass and flowers and a few weeds. You don't want to blowtorch the whole garden, because then you'll get more weeds coming back. Get that. That's been my analogy. I've got slides that from seminars I gave before the internet. So I started the idea of the garden analogy. I started the idea of the ocean analogy, because this planktonic bacteria and the way that works is like the ocean traveling around. The garden idea is the stuff that's stuck on your teeth that you really can't change very easily. You just want to modulate it. Pull out the weeds with the xylitol, loosen them up, brush your teeth, yes. Clean your teeth, yes. Eat healthy things that nurture the good bacteria, like feeding the grass, feeding the flowers, and let them do the work. Let it come from the inside to change things. And the studies that show a rise in blood pressure, or that mouthwash causes diabetes, we have to look at those studies because those studies were so poorly reported by the media, if those were studies you've listened to or heard about. The mouthwash involved was chlorhexidine. It wasn't Listerine. It wasn't any old mouthwash. It was very specifically chlorhexidine because chlorhexidine is way more powerful than any other mouthwash. And if you ever see a study that's talking about antiseptic mouthwash, they mean chlorhexidine. In the scientific world, Listerine is an essential oil mouthwash. That's how you would describe it in a scientific study. And the one study they did that showed an increase, more risk of diabetes with mouthwash, you need to know that that study was done in a community of obese individuals. They did not look at their gum health when they started. They didn't look at diet. It was self-reported. They didn't look at which mouthwash they were using. They simply said people who use mouthwash more than 3 times a day were more likely to develop diabetes. They didn't tell you these people were obese. They didn't tell you these people may have had gum disease. They didn't tell you what their diet was about. Why do you use mouthwash 3 times a day? Because your mouth feels nasty and yucky, probably. You know, it's an unfair study. And then there was a study done with colon cancer. Listerine causes colon cancer. Well, they did that. Yeah, there was a study, 15 individuals. They were homosexual men in a sexually transmitted disease clinic. They didn't look at their gum health. They didn't look at their sexual habits. They didn't look, you can do a study in the wrong group and find pretty much anything you want to if you don't look at the whole. Well, why wasn't there a control group? Why wasn't, I mean, none of this, these studies being promoted today, I would say to your viewers and listeners, if you're not a scientist and you're not reading the study and understanding it and looking at the statistics, don't listen to the media, because what I hear on the media is absolute garbage. They did a study with xylitol. They did the study with 10 really sick patients at the Cleveland Heart Clinic. Those patients, most of them were in cardiac failure, had cardiac failure. They were diabetic. We don't know what they were eating. We don't know what their gum health was or their mouth health, or even if they had teeth. We know nothing about these individuals, except they were put on a fast. And at the end of this fasting, they were given 30 grams of xylitol as a small drink. That's not how anyone suggests you ingest xylitol. See, the cool thing about xylitol is it helps stabilize your blood glucose. And our bodies make 15 grams of xylitol every day to level out our blood glucose. And it does it, and then it dismisses it. It actually gets rid of it. It excretes it really fast. So the 15 grams that is made in our body probably is being made during the time where we don't really know whether it's all day, 24 hours, or the hours we're awake. The more research needs to be done. But you don't have this bolus of 15 grams of xylitol all at once, any more than you would take. I mean, not 15 grams, 30 grams, twice what the body makes in a 24-hour span, very gently. It's like salt. Our body needs a little bit of salt. But if you were to drink 30 grams of salt, that is six big heaping teaspoons of salt in a 2-ounce water glass. Well, I think I'd throw up, but you'd have some effect, right? Well, these people, that's what they did to them. These sickly, elderly people, we know very little about them. They gave them 30 grams of xylitol in a small drink, took blood. Nobody had a heart attack. Nobody had a clinical event. Nobody even threw up. Which, as I say, if it had been salt, I think they would have had more vomiting. But these patients, the blood they took, when they looked at it under evaluation for metabolites, they saw there was an increase in metabolites. Well, it was 6% increase. Had they had a cigarette, it would have been between 1 and 200% increase. It's a tiny increase in metabolites. They also saw there was increased platelet activity. By what measure, we're really not sure. And what does that mean? We don't know. But the media reported that they showed pictures of toothpaste with xylitol in it or chewing gum with xylitol in it and said xylitol found to cause heart attacks. I mean, that was the media reporting on the news. Even dentistry didn't stand up and say, that's a lie. Is it a lie or is it just misinformation? There was private equity behind that study. There are people developing something behind that study that actually competes with xylitol. And interestingly, just so you know, it competes with xylitol in the gut. Because one of the attributes of xylitol is it feeds the good gut bacteria that form butyrate. And butyrate is the lining material that protects your gut from becoming a leaky gut. It's kind of the material that's made when you consume fiber. And xylitol is soluble fiber. And that's why people who are not used to fiber can have a little bit of problem getting used to xylitol. They'll say they get gas or they get bloating and you know, the Eskimos, when they change from a diet of blubber in the winter to vegetables in the summer, they go through the same thing. Their gut bacteria have to modulate themselves to adjust to breaking down fiber. And in that process, sometimes you'll get a little bloating and gas. It's not a bad thing if you can work your way through. Just have less and give yourself time, sometimes a month or two, to familiarize your gut bacteria with this fiber. I recommend if you want to do xylitol and you're not used to eating fiber, take a gut probiotic at the same time, you know, something that's, you know, good for the gut biome. I have my favorites, and I think, or you could just drink some kefir and eat, you know, just to nurture your gut along. Fermented foods, sauerkraut, you know, these things, it's all the same. Trying to get your gut healthier. And xylitol's in that mix. And that's why I object to the study that pointed fingers at xylitol, because they are making a drug that's going to do that. So, you know, just be aware that studies that come on the news are funded by people with lots of money. People in the xylitol world don't have any money. It's not a money-making product, I can assure you, which is why it's never been picked up in America. It's complicated to explain. It's expensive ingredients. You know, it's not what anybody wants. Even Colgate doesn't really. They used to make a xylitol toothpaste back in the early 90s, but it wasn't money-making, so they didn't keep making it.
Yes, point taken about the about studies and money going into studies. Absolutely agree with you on that. When we get older, lots of things change. So does our oral microbiome change? And would that make any changes to your system? Would the system still be applicable? And I guess why is the oral microbiome so important for our overall health?
Well, I think this nitric oxide component is huge, because when you're young, you make nitric oxide elsewhere in your body. As you get older, you don't. That the epithelial lining cells of your blood vessels aren't functioning usually that way anymore. So you're going to be dependent on the nitric oxide coming from your nasal passages and your mouth. So that's the first thing. If you are having a problem with your heart, your breathing, or your cognitive health, that's what nitric oxide, as you swallow this gas, helps you to do. It loosens the musculature of your heart, your breathing, and helps your cognitive health. Now, stomach acid is the final component. After you have that reaction by the denitrifying bacteria in your mouth, they turn nitrates into nitrite, and the nitrite hits your stomach acid and becomes nitric oxide. Stomach acid is really important. I know a lot of elderly people taking proton pump inhibitors or other things, or having acid reflux issues. Be aware you need stomach acid for nitric oxide production, and you're relying on your mouth and nasal nitric oxide production for these important additives to help your thinking and your breathing and your heart. Now, nitric oxide in the nose will only reach you if you breathe through your nose. How many elderly people do I see walking around with their mouth open? Shut your mouth, breathe through your nose. Do you have allergies? Do you have sinus problems? Well, there's a xylitol nasal spray could help you with that. I have nothing to do with this company either. It's a great little nasal spray. I use it preventively. I don't put this big thing right up my nose. I just put it to the end of my nostril, spritz it, sniff it up twice a day, both sides, and then I blow my nose, and you'll be amazed how much clearer your nasal breathing feels. Take care of your sinus passages. Maybe you do a steam. Eucalyptus steam is good for your nasal passages. Eucalyptus, very good for your gums. If you're steaming, I mean, why not get a steamer or my mother used to have a bowl with hot water and put Vicks or something in it. Well, I put a little eucalyptus in there maybe, and just inhale and let it be in your mouth and your nasal passages in your throat. That could help everything in your don't do too strong. I mean, be careful. These essential oils are powerful. But I'm just saying, there are things we can do to keep our nose, the nitric oxide. Be aware of your stomach acids to keep that healthy. Maybe upper digestive enzymes are necessary. I'm all about papaya and pineapple for gut health. I mean, and I've been teaching this nutrition for health since I was 20 years old. I have eaten this way since I was 20 years old. I hate to say I've never had a sick day. I can say that because my working career life being a dentist is over, and I never had a sick day. I never called in. I never took a day off. I have really take nutrition incredibly seriously. I believe it is a life force that we need to respect. And I was lucky I grew up in a family that grew vegetables, and we ate fruits, and I wasn't in the fast food world. So I've never eaten that. And I understand it's hard to come back. But I do think, like oral health, and you asked me the question, I'm trying to stick to the topic. It takes 15 to 20 years of bad neglect to see what you did, whether it's in eating or whether it's in oral care. If you think, oh, my teeth are fine, my dentist says brush and floss, and I'm fine. What is fine? Fine to me is you go to the dentist, you say, do I need a cleaning? That's what I do. I go in, I sit down, I have evaluations. I say, do I need a cleaning? I go to a good dentist, experienced, not the young one that needs the money. I go to somebody who's, paid their dental mortgage. I mean, that's my advice to you. Go to a dentist that's experienced. And I'm told, no, you have no plaque, you have nothing, take some x-rays. I do the microbiome testing. You can maintain oral health if you are doing it right. If you're doing it wrong and you suddenly find, oh, I've got some small cavities, change what you're doing. What you're doing isn't adequate. And my system is so effective. If you are told you have small cavities or your granddaughter has small cavities, if you take it seriously. And that involves stop eating and drinking between meals. Stop it, all of it. Sipping anything, that coffee that goes on for 2 hours. Got to stop. Got to eat and drink at meals. No to-go cups, nothing. And then you go to the next meal. Eat, drink, have some xylitol, end the meal, 2 hours. These patterns of eating is far more important than I want you to eat healthy, but it doesn't matter if it's acidic or what it is, how you eat what you, I don't know if you're paleo or vegan, or it doesn't matter to me. You eat what you believe in, but end it with some xylitol or tooth protective food. But xylitol is the best because xylitol will stimulate healthy saliva to come into your mouth. It'll feed the good bacteria in your mouth. And then you don't eat or drink for at least 90 minutes. The first 60 minutes, minerals are going into your teeth. And if you've just eaten a really healthy lunch, say you've had salads and celery and beets and greens, all those nitrates will have been absorbed by your healthy gut, because we hope you have a healthy gut. It goes around your body because we hope you're exercising and moving. In your salivary glands, it's like a bird's nest. The blood vessels create this bird's nest, and then the salivary gland is inside that. And there is a direct exchange from the blood into your salivary ductwork. And then these minerals get changed and concentrated and then pushed through these ducts into your saliva in your mouth. And when you stimulate a flow of saliva, as we do with xylitol, it's kind of like the fire department. It's like, oh, we need saliva. And so they bring all their minerals with them. And it's super saturated with minerals when you stimulate salivary flow that way. And those minerals know there's a drama in your mouth. And it's like, okay, how can we help? And they drop minerals on your teeth. And they have immunoglobulin, immune cells that will help heal your gums. So why would you sip another sip of coffee or another sip of tea or anything? Because you'll dilute this supersaturated solution. You're going to thin it. You're going to make it impotent. Leave it alone. Don't test it. Don't add more xylitol. Don't do a thing to it. Leave it alone for 60 minutes. And then at 60 minutes, all these nutrients, as I said, were going around your body, get into your saliva. It takes them an hour to get into your saliva. So at 60 minutes, if you start drinking again, you're not going to have the nitrate benefit on the good bacteria at the back of your tongue. And so wait 90 minutes and you will have the benefit from the nitric oxide that is going to give you your heart, breathing, and cognitive extra help. And these people who say that mouthwash eliminates nitric oxide possibly do not understand the timing it takes. If you simply drink water, drink some Evian water, it will wash your mouth as you're drinking it, won't it? I mean, you put it in your mouth and it goes around your mouth, picks up all the bacteria, all the saliva. It's not damaging your biofilm stuck on your teeth. It's just picking up everything that's fluid in your mouth and mixing with it. And then instead of spitting it out, you're going to drink the Evian water with this bacteria in it, with your saliva mixed with it. It's a mouthwash. If after that mouthwash you do your nitric oxide test, it'll be bland, it'll be pale, it'll be showing that you don't have nitric oxide happening. It's not that the Evian wiped out all your bacteria in your mouth. It just collected them and you drank it instead of spitting it out. Do you see how saying mouthwash damages nitric oxide is absurd? Drinking a drink does. Hot chocolate, doesn't matter what it is. You have to stop eating and drinking for 90 minutes, which most people never do, in order to have the full benefit of nitric oxide. Does it matter to a young person? Probably not. Probably not, because they're making so much elsewhere in their body. If you're struggling and you want the maximum amount of nitric oxide you have in your body, and you're elderly and sickly and you've got diabetes and everything else, just stop eating and drinking between meals for 90 minutes. And maybe if you eat this really healthy meal, you'll suddenly feel a change. It's complicated. But you can't just say mouthwash causes blood pressure to go up, or nitric oxide causes blood pressure to be depressed because it's loosening the pipes, it's widening the pipes, so it causes blood pressure to go down. You know, it's so hard to explain science when it's done driven by the media.
Yes. Uh, and that thing about so understanding about the 90 minutes is really interesting. So it's even like water or coffee or anything.
Anything's good. You brushing your teeth, cleaning your teeth, anything. Doesn't matter whether you're using mouthwash or not.
Right.
You know, I don't know who started this. Actually, I do. And I don't know why they started it, except I think I do now. And I get upset because it's not the truth. And if we're scientists, when somebody is raising their hand and saying, hey, wait a minute, I use 6 mouthwashes a day, and my nitric oxide levels are, for a 75-year-old woman, extraordinary. Let's talk about this. Let's not just say, I don't want to listen to you because that doesn't fit my program. You know what I'm saying?
Yes. Yeah. Okay. That's so
I'm very outspoken because I think people need to know, and I think people are giving up mouthwash or being scared. And you know what? I think being scared is one of the worst things for our health, whether it's oral health or whole body health. Being fearful, being anxious, creates all sorts of hormones that are bad. And you say, why does oral health deteriorate as we age? I think only because we've been doing the wrong things for too long. And I was going to say to you, my mother started eating poorly at the age of 80. My father had passed away. She met a young man of 70 who liked Wendy's, IHOP, Dairy Queen. She'd never been to these places before. She thought it was fabulous. They would go from breakfast to lunch to dinner for 15 years. She was fine. But then things started to deteriorate at the very end. And I don't know if it's just because she got older but I believe that her blood pressure went up, so she got medications for this. And, if she had still eaten salads and healthy things that we had always eaten all our lives, but she thought the microwave was fun, and she thought these places would take, she didn't care what she ate at the end. She was just having fun. And there's something to be said for that. But I personally will hang into my diet. I believe it's a key component, but I can't prove it.
yeah. I think we'll leave diets. Diets are very
very hard. Yeah.
Very, very difficult, and lots of people have very strong opinions about them. So we'll leave them. Okay, so Dr. Phillips. So that was very interesting. Now we talked about your system, right? But you have videos which go through the system in more detail, and they explain all the ordering and everything. So where can people go if they want to see how it actually all fits together?
Well, I used to teach this to my patients. And one of the greatest things was, the first thing we would talk about is gum massage, and I would actually get a toothbrush and stand behind them. I'd give them a mirror, and these were adults. I would brush their teeth, and they would say, gosh, that's the first time in my life my teeth feel clean. How you brush your teeth. And it's really hard to do that, not physically. I hope somebody one day will help me do some sort of 3D, because we tried to do it on a person with a video. I have the little teeth, and I try and explain, I want you to brush way up here, right up where the roots of your teeth actually go into your gum. I want you brushing up here. It's so hard to explain because so many hygienists don't teach that. They teach the old-fashioned way of putting your toothbrush at some sort of 45-degree angle and jiggling it around. And I don't, and water flosses. I don't get into water flosses because I think they can be as negative as they can be positive. And when you have a healthy mouth, I think you can do all sorts of things, but let's get your mouth healthy first. Get to the point where you go to your dentist and say, do I need a cleaning? And they go, no, your mouth looks terrific. And you can do that at any point in life, I believe. Any point. You can bring back not all gum recession, but you can bring back the health of your gums so that they're tight around your teeth, so that they're better than they were before. How much gum recession can come back really depends on what caused the gum recession. Because if you lost a tooth and that means you lost bone, you're not going to, you can't like miraculously regrow that. So there is some misunderstanding out there because I'm not your dentist teaching you what you can do. But I do believe that if you try my complete mouth care system and follow, I have a boot camp. It's a video boot camp on my website. It's like over 10 years old now. Every question anyone ever asked on that boot camp is written down and I answered it. You know, you can't imagine the questions people have asked. Some people read them all. We're thinking of transferring it to a more modern platform, but we're so scared of losing all this data. The questions and answers are invaluable to people. They love it. You know, I've answered questions since the internet began. I had a blog spot, Ask Dr. Ellie, back in 2002. You know, I haven't recorded all this stuff. Some videos are out there from, you can throw back Ellie, I think it's called, or something, and it's me with long hair in my, like 30 years, well, no, it can't be 30 years ago, can it? When was the, 20 years ago anyway, teaching the same things. Nothing really has changed. I think I've got better at teaching it. And my new book, which is Kiss Your Dentist Goodbye, second edition, will be out in 2025, January 28th. And I think my hope is that that is as close as I can come, because I'm not writing another book, I don't think. It's as close, it's taken me years. It's so painful. Anyone who knows me knows the pain I've gone through. I hate sitting down, and I can't write standing up. And it's all of it, how it works, why it works, what the science is, all the stuff we've talked about today, biofilm. But as crisply, my publishers have been ruthless to me. Many days I've said, I'm not doing it anymore. And I have refused to edit. And I got so mad with them, but they actually have tailored it down. People say, what are you doing for 2 years? But it's so easy to read. They've made it so crisp and clean and clear. I think people will be happy, because my first book was interesting, but maybe repetitive and long and stuff you don't really need. They've cut out all the history stuff. This is just about how to get your teeth healthy. Boom, boom, boom. And what to do if you don't have the complete mouth care system, if you live in Middle East or South Africa or somewhere. And I teach you that too. It isn't all about the system. That's the nutrition and the gum massage and what else can you do if you can't access that? And I do teach that with understanding. And then the final chapter in that book is, how do I deal with my dentist? What do I do with my dentist when I'm doing all of this? And I say, don't say too much. I think it's a big mistake to go in, I don't floss anymore. I think you go in saying nothing. Be evaluated. And I talk about what is a good evaluation. It's far more than they do usually. I think you should be looking for cancers. I think they should be looking at carotid artery health. I think they should be doing this bacterial testing. I mean, I think that our evaluations are under par at the moment. When you go for cleaning and x-rays, that's not what you need much more than that. Okay. So I'm not against dentists. And believe me, this book it's just challenging dentistry to be better.
Right. It sounds really interesting. So I am looking forward to that coming out. So your website is drellie.com.
.com.
Yeah. And
DR and then ELLIE.com. There are people out there try to catch you with different spellings of Ellie, I guess. So make sure it's ELLIE.com. The products that I make, I mean, may I just say that I made these Zellies 25 years ago. I mean, this is nothing new. I couldn't find in America xylitol. And another part of my life is I opened a coffee shop because I couldn't find decent coffee either. And I had waiters with bad teeth and they were eating Altoid mints. So I made these xylitol mints for a gumball machine at the back of the restaurant. And the waiters who used money back then used to put a quarter in and get a little portion cup of mints instead of the Altoids. And they noticed how their teeth got better just with that one change. And it was they who put the Z for xylitol with my name, Ellie, and an S on the end. So that's how they became Zellies. And now we sell mainly on Amazon or our website, zellies.com. But for children, we have flavors that my grandkids are now teenagers. They've obviously grown up from day one on xylitol, not a cavity between them. 8 of them. Big old teenagers who do video games and don't talk to grandma anymore. But, they got great teeth. And when they smile at me, I'm like, cool.
Yes, the important things in life. Yeah. No, excellent, excellent. Okay, and then you have a YouTube channel, and on the YouTube channel, that you have your videos, which go into a kind of more detail on exactly how the system, if somebody wants to implement it, they can watch
Yes,
those.
and the science, I'm going to go more into the science now. I'm not looking for subscribers particularly. I mean, it's not, I don't do YouTube for that. I found YouTube as an extension of what I've done since 1972, which is teach patients. I used to have a side carousel and a projector screen, and I would go to prenatal clinics and teach mothers back in the 70s. And then as I went along, I would obviously teach in my office. I would have a Saturday morning education in Eastbourne, in my dental office in Eastbourne, sunny Eastbourne, England. Saturday mornings, if you wanted to learn, you could bring your kids and yourself, and I would teach instead of doing dentistry in my office. And then in America, I started with ballrooms, and I would charge you $30 to come, and we do a PowerPoint. And when you left, you'd have a little bag with the whole complete mouth care system kit, everything you needed to get started, but that cost nothing because I would give it to you. That was your ticket to my seminar, but I would get you to go home with what you needed. So I've done all those things all the way through. I've given talks in libraries and health food stores and demos with xylitol in Whole Foods. And I mean, I've done this all my career. I'm passionate that you understand and you know why you're making a decision. Because there's science, nothing, you don't just get a cavity. It's not remarkable. It's a process. And if we forensically dissect why you have what you have, whether it's an ulcer or a gum disease, we'll find out why you have it if you want to. Trouble is, I don't have time to do that anymore. So I'm trying to put it in a book so you can dissect that for yourself. Find out what the problem is and then deal with the problem, the underlying root cause of dental disease. It's bacterial. It's a bacterial imbalance. It's what it is. And gum disease is a tough one to get rid of. But you can. Don't listen to your dentist that you can never. You can modulate, but it's tough. And it means your gut health has to be healthy. Your right toothbrushes, your brushing mechanism, everything. It's a big challenge.
So okay, excellent.
So long. Any more questions I should answer?
No, we are good. Thank you very much. Okay.
Well,
Dr. Phillips, thank you so much for joining us today. That's been really wonderful.
Well, thank you for having me.
You are welcome. It's been really fun talking to you.